Today we have some items from the optometry section of the Touma Museum. The optometry section kind of encompasses anything that has to do with the eye and vision correction. We do have some medicinal things in this collection also. But let's start with the eye itself. An ophthalmoscope is one of the common instruments that physicians use, opticians and optometrists use to check out the internal structures of the eye. This ophthalmoscope is from about 1830 to 1880. It was a very simple ophthalmoscope in that it's a mirror which provided reflected light, and the physician would hold this up to his eye and view through the hole in the mirror the internal structures. Now, this depended on the light that was available in the physician's office or wherever the ophthalmoscope was used. But this did allow good visualization of the retina and other structures inside the eye. So this is early to mid 1800s. As time has gone on, of course, things improve. What we have here is an ophthalmoscope which does not have a mirror, so obviously it would have to be used in very good light conditions. It does have a handle, if I can get it out, and it broke down so that the physician could use this in different locations and it would be easy to transport. Again, the physician looked through the hole in the back and then just, again, view the internal structures of the eye. This ophthalmoscope has additional features, as any improvement would, and along the periphery here of the internal disc are various lenses that the physician could put into the view path and determine whether a correction of a plus or minus would be needed. That is a concave or a convex type of lens. The various lenses are marked on here, and those will indicate which is needed. This is mid to late 1800s. Let's say in the mid to late 1800s, we started with electricity. Electrical current was not commonly available in physicians' offices or even homes at that point. So we ended up with having battery-operated instruments. This obviously is a more complex instrument. You can again see the progression. Does not have a mirror as the previous one did, but we're looking at late 1800s, early 1900s. This actually is a battery-powered ophthalmoscope, and fortunately, this looks like it would take what we commonly call today a C-size battery. So we would put 2 or 3 in here depending on what's needed. And again, the physician would have this side towards them. I'm sorry, wrong. This side. And on the back here we have the light transmission path with a mirror which would then reflect directly through the lens into the eye. And this one again is more complicated. It has various knobs and lenses that can be put in. The lenses can be put into the vision path, and again, progression. Interestingly, this is owned by a Dr. Edith Harvey. She was one of the earlier physicians, so we're talking about late 1800s, early 1900s. I don't have a date for her, but that's about the time when women were starting to get into medical school and become physicians. We can go a little further. Obviously, the ophthalmoscopes have changed over the years, and the instrument you would see in a doctor's office today would be very similar, but not as complex in terms of all the strange dials and different lenses available. The current ones are very simple to use and also are electrically operated. A couple of other things that end up being used in the early 1900s. This is a home item. You wouldn't have to go to the doctor's or optician's office to determine what your prescription would be, although they are would have been more experienced in determining what you need than you would at home. But this could give you an idea of what you need. On the side here, you have convex or concave, and then on the top there is a scale determining a lens strength. So how this would be used is you have a chart across the center, much like the chart in the doctor's office, and you would hold it up and move this, okay, there we go, this piece in or out until you could read it very well. And it says on there, count the dots. So you would start with a larger dot and go to the right for a, succeedingly smaller dots until you could see the whole line, at which point you would tighten it down, and then you could read the lens strength that you would need for that particular eye. Again, one of the home items. There were a lot of quack devices out at this point to help your eyes, help in quotes obviously. But one thing that did help was various eye medications, which would be stored in a bottle similar to this. This one is for collyrium. It's one of the patent or trade names from the time. We're talking about early 1900s at this point. And since there were no eyedroppers at that point, you would put an amount of the medication in the eye cup, hold the eye cup up to your eye, and end up, of course this would be up against your eye, and then open your eye while it's in there and wash the eye out and provide whatever medication was needed at that point. Your eye physician would commonly prescribe something like this. And there is a large number of different eye cups. They're made of glass, they're made of plastic, they're made of metal. If you want to get fancy, some are amber, which is quite expensive. Most of the plastic ones are an early type of plastic, either Bakelite or a colloidal type of plastic. So that was a home remedy and quite commonly used. Based on the number of eye cups in our collection, I'd say they were very commonly used. For more professional treatment, at least for refraction or eye lens errors, again, you could start with the home item, and then you'd go to the optician, and the optician would have a case like this. And that's called a trial lens set with a trial glasses. These would be put on, and the optician would then, maybe based on what earlier tests were done, would put different lenses in, let's see, it fits in there. And you would essentially have one eye covered, and then, okay, is lens 1 good or lens 2 better? And we go back and forth, much like you do today. Is 1 better or 2 better? Although today we end up with the big thing in front of your face with the various lenses inside. But the trial lens set was something that was very important for opticians and would end up with a lot of lenses. Fortunately, they don't have to use all the lenses. They have a good idea of what you need to start with from tests that were done prior to this stage. Going from that, we start with eyeglasses. This is a common pair of eyeglasses from early 1900s, maybe late 1800s. The bridge type varied, but a lot of times you would end up having these done at a jeweler's. You'd essentially get your lenses from the optician, go to the jeweler's, and get your eyeglass frames and what have you. That was common for the more expensive type. But you would have a case, and the glasses would fit in the case, etc. This one happens to be metal, and the glasses are not the ones that belong in here. As you can see, they kind of stick out, and that would be very bad to try and close. Eyeglasses became kind of a fashion item. We've all seen from older films, you have the ladies at the opera looking through their lorgnettes and looking down on other people since they're in the higher price seats. These folded down and would be very compact for storage. This is a plastic type from the early 1900s. Here we go to fancier. This is tortoise shell. Again, they fold down. These do not have lenses, so you would have to have the lens made for the particular lorgnette. For those who want to be even fancier, we have the spring open lens. Again, more compact, but depending on your status, these could be gold, they could be other precious metals. This appears to be amber, but it may not be. It may be an early plastic that kind of looks like amber. If it were amber, it'd be very expensive. And then you can get more ornate. This one is, again, this is a folding bridge. This is kind of a spring bridge that would close up. This one gets even more complex in that, there we go, the bridge folds and then turns down in. Along the same time, not only did you have lorgnettes, but you have what's called a pince-nez, which is French for pinches the nose. That's how they work. They would spring out, and then the bridge here would close against your nose. And this one is very uncomfortable because it's not padded, and I don't want it to leave a mark. The clip here would be clipped into a collar, or again, this is a woman's pince-nez, and in order to prevent loss, this would be clipped, and if for some reason it did come off, it wouldn't go anywhere. And now we have what are either called driving goggles, or they're used for fluoroscopy in a doctor's office. They would be tinted lenses most commonly, and again, this is just put on over the nose and tied in the back. Early cars really didn't have much in the way of windscreen, and if you're going down a dusty, dirty road, you end up with a cloud of dust, and it helps you to see. The versions that are used in the doctor's office for fluoroscopy were generally used in a darker room, and the tint in the lens would provide a higher contrast and allow the physician to see more of what was on the fluoroscope.